Thank you, Kelly, and good morning, everybody. So today I'm going to talk to you about doing Medicaid appeals, but a specific type of Medicaid appeal, which is appealing Medicaid managed care service denials. I have quite a few slides. I'm going to try to get them through them in an hour, but my email is on the first page. So if you have questions that don't get answered, or if there's any follow-up, please feel free to reach out to me. We are happy to provide any information you'd like. Also, I want to just flag that at the end of this presentation, I have a brief survey. It's not an official Zoom survey. It's a Google survey link. So if you can at some point look at the slides and take that survey, I will also send it out separately as an email. And it's about whether you want a more in-depth training on a specific type of managed care appeal that I will sort of reference as we go through. So just try to see what the interest level is. Okay, so let me explain a little bit about the Pennsylvania Health Law Project where I work. We are a statewide nonprofit legal organization, and our focus is on ensuring access to public health coverage and services. Our primary focus is on Medicaid, although we do a little work in other areas. We offer a free helpline for clients and provide advice and legal representation. We do not have income limits. Some of our funding has income limits, but we have the ability, depending on the funding source, to serve people of any income. Obviously, we look at whether or not there are other resources available too when making those decisions. We also provide technical assistance to other attorneys and advocates, so anybody who is listening in can get technical assistance. We do community education, training, and self-help materials, and the self-help materials are available on our website. We have a monthly email newsletter that provides updates on health law news. So a lot of updates on what's going on with Medicaid. During COVID, it's been a lot of updates on what policies have been put in place during COVID. And we also do a substantial amount of policy advocacy with the state and sometimes even with the federal government to increase access to quality healthcare coverage and services. So today, what I'm going to go through is I'm going to give a brief overview of Medicaid managed care and what that is. And then we're going to talk about appealing managed care. I'll give an overview of the multi-step process, and then go through the process, which includes internal appeals and external review and fair hearings. I'll take questions at a couple points and also at the end. And then, as I said, you can email any questions you want to me when you get a chance, or if there's something that we didn't get to. As I go through this, I am going to be talking about a specific type of managed care service appeal as for examples. So even though I'm talking generally about managed care appeals, I'm going to focus on people who receive what's called personal assistance services, which is home care, because that is a lot of what we are seeing right now. And I know some of you are also starting to get calls regarding these types of appeals. We're not going to be, it's not an in-depth training on personal assistance services and appeals. That is what I'm considering offering, and PHLP may offer in the future. But I want to let you know that that's where the examples will focus. And when we're talking about managed care appeals, I'm really talking about what happens to people after they get on Medicaid. So this is not about getting on Medicaid. Everybody who has an appeal for a service denial is already on Medicaid. This is about what to do when your health plan through Medicaid says you can't have that service, or you can't have that service in the amount that you think you need it for. So there's a little bit of terminology, and I always put a terminology page just because the acronyms are just abound. But it also makes it easier to put information on a slide when I can use an acronym. So I'm going to talk about aid paid pending. This is a concept that exists for appeals. It exists in eligibility appeals and service appeals. And it means that someone can continue a service that is at issue in an appeal while it's pending. So if somebody has a cut to their 50 hours of home care and they appeal in time, they can continue getting that service while appealing. You're also going to see CHC, which is Community HealthChoices. This is a type of Medicaid managed care plan. Briefly, you'll see HCBS, which stands for Home and Community-Based Services. These are Medicaid services that help people who are aging or have disabilities live at home and could pursue their goals for community integration. So really so they can live and work in a setting of their choice and not in a facility. You'll also hear HCBS called waiver services. So it's the same thing. Home and community-based services are the same as waiver services. LTSS stands for long-term services and supports. That's a broad term that encompasses both home and community-based services and nursing facility services. MCO is a managed care organization. That is the health plan. So MCO equals health plan. And PCSP stands for person-centered service plan. I'm not going to get into this in depth, but generally, if somebody is on a waiver getting home and community-based services, they have a service plan that's developed that describes their needs and their goals, the needs they need for their disabilities, their goals for community living, and then it outlines what services the person will get from Medicaid to support those needs and goals. Okay, so let's talk about Medicaid managed care. So again, we're talking about Medicaid after somebody's already been determined eligible. And in Medicaid, there are two types of ways that people get Medicaid services, like, payment for doctor services, payment for dental, payment for home care. And that is through something called fee-for-service or through managed care. Fee-for-service is traditional, but less common now in Pennsylvania. Under fee-for-service, the state of Pennsylvania pays your doctor directly if you get a Medicaid service. There's nothing in between. Under managed care, the state is actually paying private insurance companies, managed care organizations, a capitated rate to administer the Medicaid benefits through their networks. So what is a capitated rate? It's a per member per month rate that's paid for each member that the managed care plan enrolls. And broadly speaking, that amount is the same for everybody who enrolls, regardless of how much services they get. So I'm going to give you an example. So if I am in a managed care plan and you go to the dentist like once a year, and that's really all I do, my managed care plan is probably paying like, $200, $300 a month, getting $200 to $300 a month from the state just because I'm enrolled. My twin sister might have a disability and need to go to the doctor frequently, or might have a cancer diagnosis. That managed care plan is getting paid the same amount for her as for me. And so that gives you an idea why managed care plans might want to cut services and deny services, because it affects their bottom line. There is a limit to how much profit they can make, but this is an important concept because it helps explain why you see sometimes service denials that don't make sense. So all the plans, though, when we talk about managed care, they all offer the same basic benefit package. And then they are the gatekeepers to access any Medicaid service. Some services you can get very easily, and others require prior authorization. And that's usually when you start to see service denials, when the plan says, no, we don't think you need that, or we think you can do this with this cheaper service or item. Let's try, ABC drug before you try that other drug. Those are denials, and that is the MCO exercising its gatekeeping function. So in Pennsylvania, there are 3 different types of managed care plans for Medicaid. There's health choices, just regular health choices. We sometimes call it physical health choices. And this covers any Medicaid physical health benefit. So this is your doctors, your surgeons, your dentists, vision, the basic medical, prescription drugs. And then people have a choice of plan they can enroll in. Then there's something called Community HealthChoices. This is the newest type of managed care. And this is really it's managed care for people who are on both Medicare and Medicaid, but it's also for people who are in nursing homes and people who are getting Community Health Choices waiver, so that home and community-based services like home care, personal assistance services, or home modifications. And in Community Health Choices, there is also a choice of plan. So the Community Health Choices has 3 plans that are all statewide. Health Choices has about 4 plans per region, but they're not all statewide. And then finally, there's, so back to Community Health Choices. So that will cover the physical health services, and if somebody's eligible for nursing home or home and community-based services, they can get that through Community Health Choices too. Then there's also something called behavioral health choices, and this is covering mental health and substance use disorder services. So Community Health Choices, CHC, and regular health choices don't cover behavioral health services. They're not going to cover counseling and therapy. They'll cover the prescription drugs for that, but they're not going to cover it. The physician's visits are not going to cover, rehab. That's in the behavioral health choices plans. And it works alongside fee-for-service Medicaid, CHC, or health choices plan. If you're in Medicaid, you're get enrolled in a behavioral health choice plan, but the plan is assigned based on the county you live in. So everybody in Allegheny County who's on Medicaid is in the same behavioral health choices plan. And everybody in Philadelphia is in the same behavioral health choices plan. It's a different plan, but within the county, they're in one plan. Okay. Kelly, are there any questions so far? We can take a couple.
No, we don't have any questions yet.
Oh, good. Or maybe no one's listening. Ha.
Although actually, since we're breaking, I am going to launch the first of the 2 CLE polls. I'll leave it up about a minute and a half. Attorneys on the session today, please respond for CLE credit. And Amy, please feel free to continue.
Okay, great, thank you.
Thanks.
So now let's talk about managed care appeals. So if you're in a Medicaid managed care plan, you're going to encounter service denials probably at some point if you need a lot of services. We call these adverse benefit determinations, and they can happen with regular Medicaid services. We call those state plan services, which are, the general adult benefit package, doctor, dental, medication, surgery denials, or denials related to nursing home services or home and community-based services like home care, personal assistance services. But there are certain rights, which is the right to appeal that determination, the right to written notice that must be explained in detail, giving every reason for the denial. We don't see every reason for the denial. Sometimes we don't see much reason at all. So that is something we are working on at a policy level, but in theory, it's supposed to be explaining every reason for denial. And you can still appeal if there's no notice. So let's say you're getting a service and it's just cut off, you can still appeal. But if there is a notice, which there should be, it has to be sent 10 days in advance for any denial of a service that someone's currently receiving. So if someone's currently receiving a prescription drug that they've been getting ongoing, it needs to be sent in advance. If somebody is getting home care, it needs to be sent in advance, that notice. And then there's a right to aid paid pending, its ability to continue the existing services while waiting for the appeal decision. If the person appeals within 10 days of the mail date on the denial notice or prior to the effective date of the decision. So this is why the 10 days advance notice is important. The mail date is the date on the letter, but you have to look at the envelope too, because of all kinds of issues, such as the mail delays we're experiencing because of COVID, the USPS issues, and also we have seen plans not mail things right away. So it will have a notice that's dated on a Friday, but it's not mailed when we look at the meter stamp till the Monday. And that means they did not send it 10 days in advance. So watch out for that. Now, there are many types of adverse benefit determinations, and I've listed them. They can be around payment or issues whether a service is even covered, like I want a swimming pool for Medicaid, they say it's not covered. That's an adverse benefit determination. But we're going to focus on denials, reductions, suspensions, or terminations of a service when that determination to deny is based on medical necessity and appropriateness. So let me just, before we get into that, I'm going to give you the appeal framework. Now, this is not your typical eligibility framework where you have a denial, a fair hearing, then you can do reconsideration or not, and then you can go to court. There are multiple steps and there is an exhaustion requirement. And then there's a point where you can make a choice and pursue one of two avenues of appeal or both. So it starts with a denial, from which if you want to appeal, you have to exhaust the internal managed care organization appeals process. And we call that internal appeal a grievance. So you have to request that within 10 days to get aid paid pending, otherwise there's 60 days. If the grievance decision is not favorable, you have a choice, the participant has a choice of doing a state fair hearing or external review. And I will explain what those are later on. If somebody chooses, you see the state fair hearing, for both you have 10 days to keep aid paid pending, but you see a state fair hearing, you actually have 120 days otherwise. If you're not worried about aid paid pending, let's say you're requesting a new service, or let's say you missed the deadline for aid paid pending, you still have a total of 120 days to request a state fair hearing. But I want to warn people think, okay, I'll just request external review. And then if that comes back against me, then I'll request a state fair hearing. If a person's already receiving the service and they want to keep receiving it while they're appealing, they have to request the state fair hearing and external review at the same time. Because if they request the external review and don't request the state fair hearing, when it comes time to request a fair hearing after they lose an external review, if that happens, there's not going to be a continuation of benefits. They've missed the deadline. So that's really important. We always advise people to pursue a state fair hearing and usually advise people to pursue external review, but it's not that simple, but they can choose either or both. And then there's the right to appeal to court following a state fair hearing or external review. And also for a state fair hearing, you can actually request reconsideration before going to court, which also comes with aid paid pending if it involves a service that you're already receiving that's being proposed to be cut or reduced. All right, so let's talk about, I'm going to focus mostly on the internal appeals process because that's where a lot of the substantive work gets done. And then the fair hearing, if you have to do it, you've already done a lot of the work you need to do to prepare for that if you go through the internal grievance process, which you have to. So this is the most common route for appeals in managed care. There is something called a complaint. That is not what we're talking about here. And really a grievance has to do with whether or not the service that's being denied is medically necessary or appropriate. And there are three main types of service denials we see. We see services denied completely. Nope, we're not approving that surgery. We see services approved other than as requested. So they say, okay, we'll give you this service, but we're not going to give you it the way you want it, not in the same amount or scope or for the same length of time. We see this all the time with personal assistance services, the home care services, where somebody will request 70 hours of personal assistance services and the plan will come back and say, we are approving this other than as requested. We are authorizing 35 hours and we're denying the other 35 hours. And the third type we see is denied as requested, but the following service or item is approved. This is really a substitution. And for that type, an example might be somebody who, let's say, requests 70 hours of nursing services in home, and the plan comes back and says, we're denying nursing services, but we're substituting home health aid services. All three of those, even if it says approved other than requested, or we're approving the following services, but denying the other one quietly, those are all denials and they can all be appealed. I included in the materials 2 examples of something being denied completely and something approved other than as requested, what the notices look like, so you can sort of familiarize yourselves with them. Okay, now, when somebody gets a denial, it's important to make sure that when they request a grievance, the person who makes that request has the authority to do so. Because we have seen recently people's appeals being rejected, or the term is invalidated. And we're not seeing them invalidated in a way that the person even knows they were invalidated. We kind of find out, like when we go to investigate, and we're like, what happened to this person's appeal? Oh, it was requested by someone without authority. Now we're working on this from a policy perspective so that there's attempts to validate appeals when it's made by someone without authority, but trying to deal with this in the first instance will save you a lot of time. So the people who can appeal are the participant, their power of attorney, their legal guardian, so this could be a parent or a court-appointed legal guardian, a healthcare power of attorney or agent, or a healthcare representative. And those 2, healthcare power of attorney, healthcare representative, usually only have the power to appeal when somebody's doctor has said they don't have capacity for decision-making, healthcare decision-making. And then anyone that the participant designates in writing. And the appeal form has a place where that can be designated. Okay, so timing is critical when requesting an appeal. As I said earlier, and I would say a million times, 10 days is key if the person wants to keep whatever services at issue while they're asking for their appeal. And again, it's from the mail date or prior to the decision effective date. And that is why we tell everybody to save envelopes so that we can see them, to see when they were actually mailed. Honestly, you really can't see when things are mailed anymore because all you really get is the meter stamp that the managed care plan puts on. So in theory, they could just have something sit in the mailroom for a couple days after meter stamping it. But it's something, because we do catch plans all the time mailing things late, even with their meter stamp. Then if they miss the 10 days, or if they're not concerned about aid paid pending, then it's 60 days from the decision date. It can be done by phone, fax, or mail. We recommend documenting the date and time of calls and the name of the person at the managed care organization the participant speaks with, and sending a letter confirming the grievance request. But, really critical, at a minimum, document the date and time of the call. And, you can even try to get a reference number on that. I know on the Community Health Choices side, all phone calls are recorded, so that can be pulled if there's an issue. They could also be faxed or mailed. We recommend sending things certified mail so that it can be tracked. So there is a form that's attached to all the denial notices. This is an example from Community Health Choices, but it looks the same in the other Health Choices programs. And that is the easiest way to request it, is to fill out the form. But if somebody loses the form, honestly, if you want a form, I needed to create one. There is one you can pull from one of the notices I sent. They can also put it in writing and just say, I want to file a grievance. This is about the decision dated XYZ. I disagree with the decision. You don't really have to put a reason other than I disagree. Or you can just say the service is medically necessary. You want the service to say the same while waiting for the grievance decision if they were already getting the service. And you want to indicate whether you want it by conference call, video, or in person. And actually say that you want to participate. And then request all of the information that the plan used to make a denial decision. And I'll talk more about that with grievance discovery. And also who will represent and who. I mean, who will represent and what their contact information is. So all of that information is captured on the form. Now, expedited grievances are available if waiting the normal time frame could be harmful to someone's health. It doesn't have to be life or death. It's best to do a request for it using a letter from a provider like a doctor. So after the grievance request is made, there's a few things that should come in the mail. The managed care plan is supposed to send an acknowledgement letter upon receipt. So that pretty much means after they get it, not 10 days later. And it includes a description of the issue, a form indicating whether the person agrees or disagrees with the description of the issue. You don't really have to return that, although if the request was made by phone, it's probably worth returning it. And then a brief explanation of the grievance process. And then 10 days prior to the grievance review meeting, and yes, there is a chance to talk this through, the plan mails a scheduling notice with the date and time for the grievance review and information on how to attend that review. So at the grievance or the grievance review, the participant has the right to participate by phone, in person, or video conference. And they have to let the plan know they want to participate, because the plans do hold these grievance reviews without the participant if they don't tell them they want to participate. Sometimes they hold them without the participant, even when the participant said they wanted to participate. So that's a problem, obviously. They also have a right to appoint a representative. If you are doing these appeals, that's you. And there's a reasonable opportunity to present evidence and allegations of fact or law. So in other words, there is the right to make a case with arguments, evidence, and witnesses. We have seen managed care plans try to limit people to 5 minutes, 10 minutes, 15 minutes, and I would push back on that and say there's the right to a reasonable opportunity to present evidence and allegations of fact or law, and that it's not reasonable to restrict us to this time frame. So what you want to show at a grievance is really about the need for the service or item. You're trying to show that this participant in the managed care plan needs whatever service or item is at issue. And you're going to show that to show the general need, but you're also going to your goal is also to fit that need into the medical necessity definition that is used for Medicaid. And I'm going to go into that a little bit. Now, I want you to keep in mind that we're talking about medical necessity, but people who are on waiver services, like home and community-based services, some of those services they get through Medicaid are not really medical. Some of it's employment services or non-medical transportation. Even some types of home care are more like involve things like shopping, which is not a medical service. So it doesn't have to be medical in nature to fit into a medical necessity definition. In fact, there's a specific medical necessity standard that applies to waiver services. Now, also at the grievance, you can take the opportunity to point out any procedural issues that you're aware of, like, there was no notice, or the notice is incorrect, the way it's describing the issue, or any problems with the procedures at the grievance. So I was at an in-person grievance, and there was nobody from the plan who were making decisions. There were some people making sure we, were behaving, but there was nobody who was a decision maker in the room. That's not an in-person grievance. So I, put an objection on the record. It doesn't do much good. And as I'll say later, these are sort of, non-formal proceedings, but you do want to document that, and it kind of puts whoever's overseeing the grievance on notice that you're watching them. So medical necessity. This is the next 2 slides. So in all of the health choices agreements, behavioral health, physical health, and CHC, there's a section that gives the definition of medical necessity under Medicaid. And there are 3 different medical necessity standards that a person can meet. And they don't have to meet all three. They only have to meet one. And then in Community Health Choices, as you'll see in a second, there's a fourth one that they can meet. So the standards are here, but it's basically will or is reasonably expected to prevent the onset of an illness, condition, or disability, reasonably expected to reduce or ameliorate the physical, mental, or developmental effects of an illness, condition, injury, or disability, will assist a participant to achieve or maintain maximum functional capacity in performing daily activities. And that's taking into account the functional capacity of the participant and what is appropriate for someone of their age. So these are sort of nuanced. And if I were doing a training, like an in-depth training on a particular type of service, I would go into like how you can use these definitions. But if you have questions and you have a case and you're thinking through like how would dental denial fit into this, we can talk that through. But it really depends on the services and the person's circumstances. The fourth standard is only available to people in Community Health Choices and only for people who are getting long-term services and supports. That's nursing home or home and community-based services. And this is a very important standard because it sort of addresses the fact that some of the services people receive are not medical in nature. But it also is looking at the concept behind waiver services, which is to help people avoid institutional care, to have the ability to live and work in a setting of their choice. That is one of the goals of home and community-based services. And so to meet that goal, the state built in a medical necessity definition that supports that goal. So that is, the service will provide the opportunity for a participant receiving long-term services and supports to have access to the benefits of community living, to achieve person-centered goals, and live or work in the setting of his or her choice. So a tip we have on that is, I said earlier that everyone has a person-centered service plan if they're in Community Health Choices on a waiver. It's very important that their goals are in there. And if you can show a service or item will help someone meet their goals, then you're getting towards medical necessity. Or if you can show that like a service or item is needed to avoid nursing facility placement for someone who wants to stay in their home, that's part of this definition. So if I need 70 hours of PAS and they're cutting it down to 12 hours a week, I would try to get doctors to explain that like, I'm not going to be able to avoid institutional care if that happens and I want to stay in my home. So that's really critical. Okay, so let's talk briefly about preparing for a grievance. And this involves really 4 steps, 3 steps, and then the 4th step is presenting a case. So you want to sketch out the arguments about why the decision is incorrect. You want to show that the decision was wrong. Why does the participant need the service or items? What will happen if the service is taken away or not provided? And how is it medically necessary? And then also you can sketch out arguments regarding procedure, but that's really less important, especially at the grievance stage. And then you're going to do a lot of evidence gathering. So you have a right to review all the evidence pertaining to the subject of the grievance. They have to send it at this point and it has to be provided free. So I included in the materials a sample, what we call discovery request that we would send for somebody who has a personal assistance service denial in Community Health Choices. But it'll give you an idea of how detailed we go. We honestly never get all the things we want and we don't have time usually because of the time frames to fight over it. It's not like court where you can make a motion regarding discovery. But we do our best. And we really are looking generally for documents and policies that are being relied on, any instruments like and utilization management policies that are being used. So a plan, utilization management policies are exactly what they sound like. They are policies that control how much people can use a service. So they might say like, you have to have these conditions in order to get this prescription drug, or A tasking tool is a utilization management tool. So tasking tool is a tool that's used to determine how much time someone needs to perform daily living tasks. And then they assign the times and they say, this is how many hours of home care you get. You want to look at any assessments that were done of the person and their service plans if they're in Community HealthChoices. So really, and we also ask for correspondence and documentation and anything related to anything written by anyone who was reviewing the decision. And then you're going to pour through that and look for evidence that supports your case or evidence that they just were wrong in their assessments. You're also going to gather what the participant has. So this can include doctor and provider letters supporting medical necessity. This doctor letters should not just list a bunch of diagnoses. They have to show why the person needs an item or service. You also want to get medical records, evidence of medical conditions, vendor records. So for someone who's getting home care, there might be a home care agency that has a record of someone falling or wandering or any other observations of the aides. And then you're also going to want to ask the person for any of their prior service plans if they're on this Community HealthChoices waiver. Now for personal assistance services in particular, I just want to flag one thing, because this is what a lot of the cases I know people are getting, because I've heard from some of you. I mentioned earlier that the plan uses a tasking tool to decide how many hours of services you need or that the person needs. Then the person can counter this with a log showing how long it takes to do tasks and activities with assistance every day. So that's really important to show the actual time it takes to do things as opposed to what the managed care organization assumes it takes. And once you have the evidence, and while you're gathering the evidence, you want to identify any witnesses. This can really be anybody, but it's usually includes the participant. Sometimes not. If a participant has cognitive issues, they may not want to participate or may be uncomfortable with the hearing. Doctors and other providers are sometimes available, but a doctor letter that's strong, a strong letter of medical necessity goes a long way. There is a sample one for personal assistance services, more like a guide in the materials. Family, friends, neighbors, caregivers, and then you're going to want to draft the questions in advance. And these questions should be questions that help support the case. And you want to prepare the witnesses to know what to expect so that they're not surprised and so you know what they're going to say. So you're not surprised. And then finally, when it comes time, the case will be presented. To prepare for this, you want to send all the documents to the plan in advance. And you can use an opening statement, present witness testimony, present documents, and then use a closing argument when you're doing your grievance presentation. Every managed care plan conducts their grievances differently. All right, so it's the day of the grievance. I'm going to assume it's by phone right now. Most people are doing it by phone. I did hear about somebody who might be getting an in-person grievance. But I think for the most part, people are doing phone, or they're also getting some more video conference if people have the capacity to do things like Zoom. So here's what's going to happen. There are going to be 3 people who are on the grievance committee, the grievance panel. They can't be anyone who is involved in the initial decision or subordinate to that person. We had an issue with that at one point. Now, one of those people has to be a physician who is in the same or similar specialty as typically manages or consults on the service at issue. I'm not going to lie, there's a pediatrician at one of the plans, and it's a plan, he makes a lot of the decisions, he's the medical director, and the plan is only for adults. So what level of experience he has outside of pediatrics, I don't know. We're a little unhappy with what's going on with some of the plans in terms of their physician qualifications. We've had OBGYNs making decisions about home care. So there's a lot that's sort of making us wonder whether or not there's really people who have the proper specialty. But setting that aside, there's a doctor. And that person is the ultimate decider. That is federal requirement. The 3-person requirement is a state requirement, but the federal rules overrule the state rules, so the physician has to be the ultimate decider. So that's who you're really presenting to. And if it's in person, at least one of the committee members has to be present. The others can be by video conference. There are no rules of evidence. You can present whatever you want. Usually the plan does a brief introduction of like what the issues are. And there's no ability to cross-examine or question their evidence, except, you know, to the extent you want to talk about it, but you're not going to get somebody who's there to like defend. They're just going to give their point of view, and you're trying to convince the panel to change their mind. So you're really trying to get the plan to change its mind. This is not an independent review. It's recorded or transcribed, and it takes 30 to 60 minutes depending on the complexity of the issue. Now the timing on this is that there has to be a decision within 30 days from the request. That can be extended if the participant wants it extended. There should be a decision within 5 days, and then, you know, 2 to 3 days if it's an expedited decision. If the plan blows these deadlines, there's something called deemed exhaustion. So I said earlier that people have to exhaust the internal appeal process. If the plan doesn't adhere to the requirements for the internal appeal, a person can go straight to a state fair hearing. We have not done this. We would consider it for somebody who's requesting a new item or service. For people who have aid paid pending, there's not a lot of reason to make the process go any faster. Okay. I'm going to talk briefly about external reviews and fair hearings, and then we'll wrap up. So external review, as you remember, is one of the 2 options for appealing a grievance decision. It's a paper review, and it's done by an independent physician. So this is the first independent review that a person can get. That person usually is contracted with something we call a certified review entity. And in normal times, that certified review entity is assigned by the Department of Health. They have a bunch of contracts. The physician, again, has to be in the same or similar specialty. We've actually seen better luck here. So like we've had external reviews regarding patients who have dementia, and the people who are making the decisions have a specialty in geriatric medicine. So, you know, it's not always that precise, but it's usually a little better than what we've seen from some of the managed care plans. And the timing, again, is 10 days for aid paid pending and 15 days otherwise. So it's a very short time frame. It's requested through the managed care plan in writing or by phone. So again, track those requests. And then there's a lot of procedure here. Generally, I'm just going to give an overview of this and tell you what's going on right now. So this is the general procedure. Is the person's supposed to get an acknowledgement, and then an assignment notice from the Department of Health that tells the participant who the certified review entity is, how to contact them. Usually there's a fax, sometimes a phone, and an address. It lets them know they can provide additional documentation, which they should do if they have it. We recommend people resubmit everything they submitted at the grievance. We sometimes write a letter brief or arguments, or we'll ghostwrite something for somebody. And you can add additional documents that weren't available at the time of the grievance. Don't assume the managed care organization will send all the documents from the grievance. They should, but do not make that assumption. And then you have to copy all of this to the managed care organization. You will get a list of what the plan sent, but you're not going to get a copy of what they sent. And you won't get it you won't know what they sent until after your deadline to submit. Now, during COVID, the Department of Health said, we're going to have the managed care organizations assign the certified review entity from our list. That's allowed under the state regulations, but it's not going swimmingly. So you have to be really proactive, and mostly around the certified review entity assignment. Here's what you should assume. You should assume you need to submit all of the documents you want the certified review entity to see within 15 days of the date on the assignment notice assigning the certified review entity. I would assume from the acknowledgement, frankly, at this point, okay? So get it in fast, and guess what? The plans aren't always telling you who the certified review entity is, so you have to call them. And even then, we've seen problems. So this is something you really have to stay on top of, or people lose their opportunity to submit additional documents. It's kind of a fiasco. We're in touch with DHS counsel on this, and who's reaching out to DOH counsel. Okay, and then that decision happens in 60 days, faster if it's expedited. And if it's the participant wins, the MCO has to pay, even if the plan appeals, and anybody can appeal to Commonwealth Court. All right, fair hearings. So this is requested simultaneously if somebody needs aid paid pending. But you can delay a fair hearing if you explain to the judge that you're waiting on an external review decision. So if the 60 days, you haven't gotten it. You have to, if you have questions about how to do a document like that, I can explain it. But that's one reason an ALJ will explain, because they really, they don't want to waste their time if it's going to be moot. So again, you want to request this postmarked within 10 days of the grievance mail date to get aid paid pending. Otherwise, it's 120 days. There is a form that can be used, and it should be mailed, preferably certified. In terms of gathering evidence and presenting the case, use the same approach you use for the grievance, but it's going to be more formal. So there's going to be evidentiary issues. There's going to be more legal arguments. And if you lost an external review, that's going to be persuasive. You need to be prepared to counter that, because the plan's going to say, three different doctors decided that this person doesn't need this service. Our original doctor, our internal doctor, and this independent doctor. But if you read these external review decisions carefully, a lot of times they miss evidence. And I mean, we've had, not that we don't have success, but the ones that we're unsuccessful on, it's usually not that hard to counteract the persuasiveness of them. They haven't seen the person, they haven't met the person, they don't know the person, this person, they missed this evidence, they're using the wrong standard, things like that. There is a pre-hearing conference. This happens right before the hearing. The judge will say, here, I'm giving you 5 minutes or so to discuss settlement. You can try, sometimes it works, sometimes it doesn't. And then again, there's a right to discovery. You might have a lot of this stuff, but you also want to make sure you get everything the plan's going to rely on and their list of witnesses. And then at the fair hearing, you can participate by in-person or by phone. There was a pause on in-person because of COVID. They're not happening a lot, but if someone really wants an in-person, say because they want to show the judge how their disability impacts them, sort of showing their own body as evidence, they can call the Bureau of Hearings and Appeals and insist on it. And our understanding is it will be set aside for an in-person. The judge is not necessarily an attorney. The parties are the department, which is what the judge will call the managed care plan, but it's really the MCO. They present first. And the participant is the appellant. New evidence can be submitted showing eligibility for the service. And this includes eligibility. Like they might say, well, the assessment that was done to deny the service was correct at the time, but now the appellant has submitted new evidence showing that it is incorrect now and the service should be provided. That's sort of in a nutshell the juris rule for these services. So you would want to rely on that juris rule if you're using new evidence. So as I said, it's much more formal. You can cross-examine with all the caveats about cross-examining, introducing evidence. We always do an opening and closing. And if there are issues that come up that we think are complicated, we will submit briefs. And you can finally request that the record remain open for additional
I
documents.
just want to get something. My meeting's not on. Amy, this is Kelly. If I could just interrupt, I'm going to launch the second of the CLE poll boxes. Attorneys, please respond for CLE credit. Thank you. And Amy, feel free to continue.
So after the fair hearing, there'll be a decision. It's supposed to happen within 90 days of the original grievance request. That's the internal request. So that is the deadline. If the plan misses that deadline, if the administrative law judge misses that deadline, you can go to the plan and ask for interim assistance, which they're required to provide if more than 90 days have passed. Now there's a issue in the contracts where for physical and behavioral health choices, that 90 days to request interim assistance is calculated from the date of the original grievance request, which makes sense because that's the deadline for the decision. But the CHC agreement was not written quite as correctly, and the assistance is calculated from the date the fair hearing was requested. We've asked that that be changed in the next agreement once we realized that was there. Oops, I'm stuck. Okay. Now there is the opportunity for an expedited fair hearing using this similar standard for expedited grievance. There's usually a mini hearing on whether it should be expedited, and then the hearing happens within a day. Now, if a person's not happy with a hearing decision, they can request reconsideration within 15 days. That's really asking the Secretary of the Department of Human Services to reconsider the request. What the Secretary is doing if they grant it is saying, I will reconsider. It doesn't mean the decision's overturned. And then the Secretary spends time deciding whether there's an error of law or fact that warrants reversal of the decision or a remand for a new hearing. And that can take months, but there is aid paid pending available within the 15 days. So if there is an error of law or fact, it is something that people will pursue. And then finally, if all else fails, there's Commonwealth Court within 30 days of the ALJ order now or after the reconsideration. So the time frame for requesting a petition for review in Commonwealth Court is stayed during reconsideration. So I've included some authority in this because this is federal, state regs, federal and state law, managed care contracts. There's a lot that covers these hearings and the nuances of the hearings and then the services. So please, those were links that you saw in orange. And, I want to make sure you understand that PHLP is here for technical assistance, and we're also happy to provide more in-depth trainings on any of these topics. There is a survey that you can, if I can copy this link, I can. There's a survey where you can tell me whether you're interested in a more in-depth training on really how to prep a personal assistance services case. So I encourage you to fill out that survey.
Amy, this is Kelly.
Yep.
I don't think we're able to click on that to get to the survey this way, but I'm happy if you send me the link, I'm happy to email it out to participants so that they can do that.
Okay. All right, I will, yes, we'll email that out. I think they can click on it from the materials. I checked it in the PDF.
Okay, great.
So I don't think you can click from Zoom.
Okay.
And we're a little over, but I'm gonna hang around for questions because Kelly said that was okay.
Sure.
As long as people want to hang around.
If anybody has any questions or comments, please type them in the chat box now for Amy. We do have a comment, wonderful training and materials. Will the materials be emailed to everyone? Actually, all materials are available on the conference app, Sketch. They've been uploaded into that, I believe, so you should be able to access them that way. really thoughtful and well done presentation. So getting some appreciative comments,
Thank
but I'm
you.
not seeing any questions.
Okay. Well, thank you, everybody. I know it was a lot to go through. We'll get that survey out to you because I know people have questions about personal assistance services, appeals in particular, and if there's enough interest, we will do a training on that with really like nuts and bolts of how to do those, setting aside all the procedural stuff that I just went through.
Okay, well, thank you so much, Amy, for your time and sharing this information with everybody. And everybody have a good rest of the day. Take care.
Bye-bye.
Bye-bye.